to talk about are the products that we offer as far as soft tissue mobilization and manipulation in our physical therapy clinics. So the traditional model of mobilizing soft tissues is with our hands, which is great, and we do utilize that a lot in the clinic from a myofascial and a muscle tissue perspective. But sometimes using some additional equipment can give us additional benefits and also actually help our hands a little bit, so we don't wear them out too soon in our day or our career. So what I have on the table here, I'm going to kind of take you through a progression. Initially, we may want to consider what we're manipulating from the perspective of myofascia. Myofascia is the tissue that's between your skin and your muscle, basically, and sometimes we can develop adhesions and inconsistencies in those tissues that can cause some pain and persistent issues from the perspective of delayed healing. So one tool that we can utilize is a mobilization band, which is basically an elastic band that we can wrap around the affected area, wrap it pretty tight, and then have the individual move the affected area back and forth and around to mobilize those tissues to help that myofascia glide a little bit better around the area. Another option that we can use from a myofascial mobilization perspective is our cupping. So in the case of cupping, we're actually decompressing that myofascia. So we're pulling that myofascia, the skin away from the myofascia and the myofascia away from that muscle tissue to help create a little space there and help improve the mobility of those tissues. It also brings a lot of blood flow to the area. Another great tool to utilize for the myofascial mobilizations is an instrument-assisted soft tissue mobilization tool. This one specifically is the Edge tool. And here we can kind of scrape and mobilize those tissues. Some theories with that, we can actually help realign fibers of tendon tissue and muscle tissue in addition to helping with mobility of the myofascia. To continue after treatment with these mobilizations, we can then apply things like kinesio tape or rock tape in this case, which is an elastic tape that is going to help continue that process of decompressing the skin, because we apply it down onto the skin in a stretched position, and then once it's on the skin it contracts a little bit and it can continue that decompression process as the individual moves throughout their day and their life. Once we get a little bit deeper than the myofascia, we're in some of the more deep muscle tissue, working on trigger points and things of that nature. We can then use our hands quite a bit to get in there, but we can also use some tools like the massage guns that I'm sure you've seen advertised all over the internet at this point. When we use these massage guns, we have different options from the perspective of the heads that we're going to use, with different goals in each one. When we're working on deep tissue work, we want to use the point of your head to be able to get in and work on that area. These are not all created equal, for sure. Typically, the more expensive models are worth it from the perspective of how intense they can become. And actually, they can also, the more intense they are, sometimes the more beneficial they can be, but also more comfortable in certain ways as they are I guess I would say they're torqued a little bit better, so that we can apply different amounts of pressure and understand how we're applying that pressure, and the machine doesn't bog down. Some of the cheaper machines will bog down if you apply more pressure. So these tools can be used kind of all over the body to help mobilize tissue, calm down muscle tension, and provide us an opportunity to bring blood flow to those tissues and then move them afterwards. What we're going to do after this is I'm going to kind of show you some demonstrations of each individual tool. But remember, these tools are just tools, right? At the end of the day, the key is movement and the key is exercise. So these are things that are kind of the gatekeepers to let us help the patients exercise, but the exercise is the key thing for their recovery. These are just something to use to get us to that point and help them be a little bit more comfortable doing that, and maybe help them recover a little bit faster between exercise sessions even. All right, thanks.